Yes, you're right.
Oh, good. Yeah, about 95.
Yeah,
Yeah,
actually, 28 years next week.
mine's November. I think. Actually, 23. Yeah. Yeah. Oh, yeah.
Okay, we have Dawn on.
You ready?
Okay, this-
Yeah. You know, like. Yeah, I don't have the number. That's not gonna make it. What's the number? Thanks for your patience, everyone. We just have one more person. We're waiting to remote in.
Are you guys hooked in? Oh, you're not, we're not, huh? No, it's not. We're not talking yet. Okay, so we're ready to go. We said April?
Okay, Fred, we're gonna stop right here.
Hi, everyone. There's some feedback. My name is Todd Hobler. I'm a Executive Vice President of the Upstate Division. I wanted to welcome you to our office and to this legislative forum. I mean, we have a really important topic to discuss today. I appreciate your patience. We are trying to do a cross upstate division-wide and a capital division presentation. So we have folks in Albany and Syracuse and Rochester, legislators there and workers there, and our officers are there. So the technical part has slowed us up a little bit. But again, want to welcome you here. I did want to say a little bit about who we are. 1199, we represent between the two divisions, the Capital Division and the Upstate Division, 35,000 healthcare workers at over 150 institutions. And we have suffered, I suppose, along with, put it that way, providers, healthcare workers, chronically low Medicaid reimbursement rates in this region. Our rates are below the rest of the state by significant margins. And we need to address that. It's having consequences for patient care. It's having consequence for turnover, staffing, and it's got to be addressed. So today we're going to talk in some detail about the problem of low reimbursement rates. We have over 20 upstate legislators, either here or on Zoom. that are participating. We have a panel, distinguished panel of employers and our members to talk about really what's going on in our facilities, in our communities because of these low Medicaid reimbursement rates. We have a presentation that is very detailed in terms of facts on the ground so that you all who are here, who are making policy, can digest really what's going on here and what we need to do. And of course, what we need to do, we have a proposal, right? So we will have some questions and answers at the end of our presentation. But right now I'd like to introduce Greg Speller, who's my counterpart in the Capital Region, and he's going to introduce one of our members that works out there. Greg?
Thanks. Can everybody hear me? Okay, good. People were nodding their heads. Appreciate it. Listen, good morning, everybody. So happy everybody can join us in this critically important panel meeting. We, as Todd was saying, we represent in our division, the Hudson Valley Capital Division of 1199. We represent 13,000 members all the way as far north as Gorham Mountain, all the way down to the city of Yonkers. And these are members who work in hospitals, nursing homes, community-based organizations who, day in, day out, take care of residents and patients and give it their best to provide the highest quality care. As I'm sure many of you know, the last several years of they got us through this pandemic. It's been brutal in terms of staff leaving the industry, short staffing, and we're going to talk a lot about that today. And we believe we have some really good solutions that we need to talk about, and we need to make sure get enshrined in policy. Todd and myself are just queuing this up really for the direct line caregivers who are the most significant voices we want you to hear today and what they're going through. And I wanted to introduce one of our member leaders who's been a CNA taking care of nursing home residents for over 2 decades here at the Grand at Guilderland, New York. I want to introduce you to our member leader, Andrea Gonzalez. Andrea?
Hi, and thank you. Hi, my name is Andrea Gonzalez. I am a CNA at the Grand Guilderland in Altamont, New York. I have worked here for over 10 years. I love my residents. I love to do what I am doing. But the job is hard.
No, it's good. What are you going through now? What are you facing right now?
But the job is very hard.
You got this.
Okay, I'll do a job.
Go ahead. And what's the staffing like right now at the facility? Are you keeping staff here?
The turnover is very hard for us here at the Grand at Guilderland. Right now, we're only working with short staffing. It's very short. It's very hard for us to work with too. Our residents are really suffering at this point in time. We need funding for our facility. We need New York State.
Thank you, Andrea. Grace?
I'm sorry.
Thank you so much, Andrea. That was a beautiful statement. And thank you, Todd and Greg, as well. Good morning, everybody. My name is Grace Bogdanov. I'm the Western New York Vice President of the Nursing Home Division for 1199 SEIU. It's great to see you all here today in person and on Zoom, and we really appreciate your attendance. I also want to thank all of the panelists, the members who took time out of work today, and the employers who came here to share their experiences. Before you'll hear from this panel, I'd like to provide some data and some information that's going to help outline the facts behind the experiences that the panelists will share with you. We are here today for 2 reasons, and the first is to close New York State's Medicaid gap. New York State has one of the largest Medicaid reimbursement rate gaps in the nation. reimbursements in New York cover only 76% of the cost of providing care. This is an average shortfall of $74 per day per resident. So we're asking for a 20% increase in the cost of funding to help close this gap. The second problem is the disparity in Medicaid reimbursement rates in the upstate and Hudson Valley regions. Medicaid reimbursement rates are significantly lower in these regions versus the rest of the state. An analysis of the most recent Medicaid rates posted on the New York Department of Health website shows the difference in rates across the state. In this chart, both upstate and Hudson Valley regions show that a majority of nursing homes are below the statewide median for Medicaid reimbursement rates. The statewide median is $248.72 per day. As you can see, downstate, the average daily Medicaid reimbursement rate is $298.64 per resident per day, with only 11% of nursing homes below the statewide median. In the Hudson Valley region, however, the average reimbursement falls to $241.67 per resident per day, with 71% of their homes falling below the statewide median. And most drastically in the upstate region, the average is only $214 per day. 90% of our nursing homes in the upstate region fall below the statewide median. Another way to look at this data is with this graph. In blue, you can see the distribution of nursing homes downstate. In orange, the distribution in the Hudson Valley, and in gray, the distribution upstate. Now, what's striking about this graph is that you can see a disparity exists across the state. Even in the downstate area, there are some nursing homes receiving less than $200 per resident per day. However, more noteworthy is that the majority of nursing homes upstate fall below the statewide median, see in gray. Now, how does this correlate directly to healthcare workers in our regions here? Labor is one of the largest expenses for nursing homes at about 65 to 70% of the Medicaid reimbursement funds. This is the same across the state, but let's talk about what that actually means. So a nursing home downstate that may receive close to $300 per resident per day is spending roughly 65% of that money on labor expenses. We're talking wages and benefits. Now, a nursing home here in Western New York that may receive closer to $200 per resident per day is also spending roughly 65% of that reimbursement on wages and benefits. But that means less dollars towards wages and benefits upstate, where facilities receive less in reimbursement as compared to the rest of the state. And this correlates exactly to wages, right? So wages are significantly lower in upstate New York. Go ahead to the next slide. According to BLS data, upstate lags significantly behind downstate, with the median certified nursing assistant wages downstate at 40% higher than the upstate regions. With similar spending percentages statewide on labor expenses, addressing this issue requires Medicaid rate increases. Now, this graph shows that the average CNA wage rates across the state, and according to the BLS data, the median CNA wage in a downstate nursing home was $21.29, and that was in 2021. This is the most recent data that we have. From the 1199 side, we know that those numbers have increased since. We also know that many downstate direct care workers have access to comprehensive health care, retirement, and training benefits through their union contracts. Downstate nursing homes also see significantly lower turnover rates than upstate New York. So there is a wage and benefit disparity. Academic studies show the links between quality of care and staff turnover. An analysis of turnover data collected through the federal government's payroll-based journal system shows the difference that compensation can make in addressing turnover issues. As you can see on this chart, there's a 36% average turnover downstate as compared to our regions in the Hudson Valley and upstate at a whopping 55% turnover. We know that quality of care depends on a stable workforce, and that lower compensation in nursing homes in our regions correlates with higher turnover rates in the workforce. Ultimately, improving healthcare worker compensation in upstate New York can play a critical role in lowering turnover rates and improving quality of care. I hope that provided a good baseline for everybody here. And now it's my pleasure to introduce this incredible panel featuring healthcare workers and employers across our regions. First, I would like to introduce Robert Mayer, the president and CEO of Weinberg Campus. So Bob, would you like to just use this mic? See if it works. Maybe not. I mean, it works. Bring it closer to you.
Okay. Well, thank you for having me here today and letting us share our story. I'm the president and CEO of Weinberg Campus, and we're located in Kettsville, Amherst, New York. Assembly McMahon, her mother was a volunteer at Weinberg, I believe, correct? Mother-in-law. So I've been there 28 years. Weinberg Campus, their mission goes back over 100 years. It was started by a group of Jewish women in Buffalo. And we've moved to Amherst in 1993, and we currently serve approximately 2,000 people every day, either directly or indirectly. We have community-based programs, but we also have 180-bed nursing home. So really, this is a defining moment, I think, for nursing homes in upstate New York. Like I said, I've been at this for a while, and I can't remember that we've ever been in the position we're in now. You know, the math just doesn't work. And Grace went through a lot of the numbers explaining to you the shortfall in Medicaid reimbursement. And, you know, for years, we were able to make up some of these shortfalls with reserves or other ways to, I'm a reformed CFO, so I kind of know how to make things work. But really at this point, I don't know how the future unfolds, because it really is a challenge. And without some major increases in Medicaid reimbursement, there's going to be some serious either facilities closing or beds taken offline or whatever, but it's not really a good situation. So, you know, we're asking for a 20% increase, which seems like a lot, but it really doesn't even make up the entire shortfall. And the challenge has been that over the last 15 years, we've really gotten nothing, no increases, you know, minimal increases, and then a take back. And even during COVID, there was a rate reduction, which was unbelievable, but yeah, I mean, so, I mean, we're, you know, and unfortunately every year we go to Albany, we've asked for money and we lobby and we meet with all the legislators, but, you know, this year is really different. I mean, the whole situation is just out of hand. So I don't want to spend a lot of time on numbers. Grace went over it. I mean, we deal with people. So really what's happening is, because of the lack of reimbursement and our inability to attract and retain staff, a lot of beds are offline. Facilities have taken beds offline that are not available anymore. And what happens then is the hospitals get backed up. I mean, they have people that they're trying to discharge somewhere that they have nowhere to go. You know, I had my wife at Kenmore Mercy emergency room a couple of weeks ago. She's fine, but I'm sitting there listening, and they've got people everywhere in this emergency room, in the hallways, on beds, and it's like, what? So then I'm listening to this story about how they're trying to discharge this elderly gentleman, probably late 80s. And the only bed they could find was out in Westfield, which is 40 miles away from where he lives in Kenmore, Tonawanda. I mean, it just doesn't make sense. So, you know, it's heartbreaking for me. You know, I get calls every day from family members asking for, can I find a bed for someone? And it's just hard. So, you know, I'll give you an example. Like, you know, we try to be a quality facility, and we have put a lot of money into staffing, and one of our wonderful staff members is here and she'll say how great we are, hopefully. But, you know, so we've gone, you know, we have the $15 minimum wage. We went to experience rates. We're trying to attract staff. And, you know, unfortunately during COVID, you know, staffing was just decimated. I mean, people just left healthcare, and I can understand why, the stress and I mean, it was just, so 10 years ago, our average cost per hour for a CNA was about $14. I looked last week, it's up to $21, probably going to continue to grow. So it's a 50% increase over a period of time. We've really gotten no additional reimbursement to cover that. So, you know, something's got to give here. And I just, you know, I'm nervous about the future. I'm usually a very optimistic person, and things will be better and we'll figure this out. And without significant additional reimbursement, I just don't know how we're gonna figure this out. So, that's my story, and I just, I feel bad for the staff, because really, like I said, I'm a reformed CFO. I used to go in negotiations and squeeze every nickel and dime and try and figure out, and they know because they sat there and listened to me. And I've kind of, I've changed. I've evolved, I guess. And that, it's not fair to sit there and squeeze these folks, and because I have to, because I don't have, the top line and the bottom line, that's, if you don't have enough money coming in, then you got to squeeze somewhere. And it just doesn't seem right to squeeze staff members. Now, next time we negotiate, we're going to have a different conversation. But, so that's my story.
Thank you, Bob. And we will see you in negotiations, but next is Nell Robinson, a licensed practical nurse, also from Weinberg campus.
Good morning. I am Nell Robinson, like you said, a longtime employee of Weinberg campus. I've been there for 27 years, actually, right after that. I started as a home health aide, and now I'm a licensed practical nurse. When I first started, the staff to resident ratio was about 1:8, whereas now it's more like 1:15, almost double. In this field of work, in many cases, we're not only caregivers, but we're the only family that some of these residents know. So it's important to me and those that think like me to make available the time and resources that the residents not only need, but they deserve. We need more healthcare funding to make the place where our loved ones live and thrive comfortable, because we want that peace of mind when we go home, knowing that our loved ones are safe and properly taken care of. So as Bob was saying about the low wages and short staffing result in high turnover. And the turnover rate in this industry is alarming right now. It shouldn't be a revolving door. The residents deserve consistency, which that's one of the reasons that I have been at Weinberg for so long. It is actually a really great place to work. These residents are our parents, aunts, uncles, neighbors, and it's our duty as caregivers to give them the quality care that they deserve. So please, New York State, we need the funding. Thank you.
Thank you so much, Nell. And next, I'd like to introduce Scott West, the Regional Vice President for the McGuire Group, the Absolute Care, and Taconic Healthcare. Busy man.
Thank you. I do appreciate the opportunity to be here today, meeting with all of you. I do want to take a second because during my career, I've been an administrator 28 years. I've had an opportunity to work with Nell. I've had an opportunity to work with James. I've heard great reputations. And, just to see the longevity up here is very impressive, and the commitment to long-term care. So I really appreciate you guys speaking from the heart. So thank you. As an administrator for 28 years, the thing that has struck me is in the last 15 years, I've never would have envisioned the changes we have been through. When I started off, would I have ever seen facilities and the staff in the facilities raise up the way they have to meet the needs of the community? If you would have told me that nursing homes across the state would be specializing in ventilator care, telemetry, dementia, behavioral units, dialysis, I don't know if I would have believed you. I think the facilities and the staff in the facilities have collaborated and done their best to change and to meet the needs of the communities, which is always changing. But unfortunately, and I don't want to say, Bob and myself and everyone's probably going to say sound very similar, but the current model is not sustainable. Wages, benefits, expenses, easily a 25% increase, Medicaid a 1% increase. So my hope is that today, in this collaboration of the panel, 1199, the different professional associations, that we'll see an increase in funding that impacts salaries, resources to the community, which would open up education opportunities, to get more folks into healthcare as a career, and other opportunities to provide education. So again, thank you. Appreciate being here.
Thank you, Scott. And now we're actually going to go to one of our Zoom panelists that is going, oh, actually, we're going to do Tammy McDonald. I'm sorry about that. Tammy, our CNA from Autumn View, which is one of the McGuire Group facilities.
Good morning, everyone. I'm not even going to pretend I know anything about how Medicare, Medicaid, anything works. I've been a CNA certified nursing assistant for 26 years. I have been at McGuire's Autumn View in April will be 21 years. I would tell you 15, 20 years ago, it was amazing. I would put my mother in there. I actually did put my mother in there for rehab. She came a stroke. She came out of there doing everything she did before she had a stroke. Years ago, we had on our unit alone, we've had like, everybody's been there at least 20 years. In the last few years, we have lost nurses, CNAs that have been there 20, 30 years. They've left, they had enough. Nurses felt unsafe that it was their license. They couldn't do it anymore. They are taking care of at least 26 residents, trying to give them meds, blood pressures. And then on top of all that, because CNAs are so short, they have to stop what they're doing to help us. It's unfair to the residents. It's unfair to the employees. Years ago, we could help our residents do all their daily care, take care of the basic needs they needed, plus more. We could sit, paint their nails, talk to them about their family, which they love to talk about their grandkids. Today, we have 15 residents at least every day to take care of. You can't even get the basic needs done, then to go in there and sit with them. And they'll be like, oh, it's only gonna take 5 minutes, honey. You don't have the 5 minutes anymore. You don't have it. Nothing against any employer. Today, I would never recommend a nursing home. Mine, any nursing home, they're all the same. Not for one of my loved ones. I know what it's like. You think, okay, older people are incontinent. You have to go to the bathroom. Oh, I gotta go right now. I know, but so does 20 other people have to go right now. It's just so unfair to them. They're treated sometimes like commodity and not people. I don't know. I know we need Medicaid, Medicare funding. That's me. I don't understand it. I know we need it. Years ago, we used to get people and say, okay, maybe we're not the top pay, but we have great benefits. We have great medical, great PTO, great pension, everything. We don't have any of it anymore. So how do you get these people to come? And most of all, how do you get them to stay 20, 30 years anymore? I don't know. I just know we need reimbursement to get people to come back, to make it a family again. We still, on my unit is a long-term unit. We still have nurses and aides that have been there 20 plus years. I think we are the only unit left. We used to have, all the units were like that. It was a family. Can you come to work today? Oh yeah, I'd love to come. Can you pick up and stay over? Yes, I'd love to. Now, if you ask me to, we're really short second shift. Can you stay? It's like, heck no. I just work short 8 hours. I cannot do it another 8 hours. So not just the residents, but the employees are going home. They're hurting, they're exhausted. You feel guilty. Oh, I know they needed a shower. I couldn't do it. It's just not fair to anyone, us or them. So please do what we can to help.
Thank you, Tammy. And now we will be going to a Zoom panelist. This is John Murray, the Chief Financial Officer for Loretto Corporation out in Central New York.
Good morning. Thank you. Appreciate the opportunity to speak for a couple minutes. My name is John Murray. I'm the Chief Financial Officer for Loretto. Been here going on my 24th year. Loretto is an affiliation of not-for-profit corporations, and we're coming up on our 100th anniversary. We have over 900 beds of skilled nursing and 800 beds of housing and assisted living. Over 70% of our residents rely on Medicaid to pay for their care. We are the safety net provider in Syracuse. Pre-pandemic, we had approximately 2,400 employees, many from the most impoverished areas of the city. There's so many cases where there are multiple family members all working at Loretto, has a real, or at least it had a real family feeling. Today, we're down to 1,800 employees. And we have 130 of our skilled nursing beds offline. That's 13%, all due to the inability to fill over 500 open positions. We're want to be and continue to be a good community partner with our hospitals. During the pandemic,
It's on there. Yeah.
can people hear me?
Yeah.
We can hear you.
John, we can hear you. Thank you.
Okay, I'll keep going. During the last several years, the way that we made ends meet was participating in various funding programs that were made available, Paycheck Protection Program, employee retention credits, reimbursements from FEMA, and we're grateful for those programs. However, these funding programs are ending, and we're left with a dire financial situation. As I mentioned, we have over 500 open positions, not only in nursing, but housekeeping, food service, and other critical components of the operation. We've always been proud to say that we offer competitive wages, along with quality healthcare, pension, and training opportunities. Today, I can't say that. We no longer can provide a competitive wage. We rely more and more on agency staff, some of whom travel in from out of town or out of state. Not only is that very expensive, but we want to provide good career opportunities to folks who live right here in our community. The 5% Medicaid rate increase proposed by the governor falls well short of what's needed to even begin to talk about stabilization of the long-term care industry. The 5% doesn't even cover this year's inflationary pressures, let alone deal with the last 15 years of no increases. Without a significant Medicaid rate increase, I truly believe we will very soon face the very difficult but real decision on permanent bed closures in this community and all of the things that go along with that, including layoffs. This would be devastating for our community and the great people that work so hard at Loretto. We want to expand access to our community, provide a competitive wage with good benefits and good career opportunities. Thank you.
Thank you so much for your words, John. Next, we'll be hearing also virtually from a member who works at Loretto, Shantina Heckman. She's a certified nurse assistant and also a unit secretary.
Hi, I'm Shantina Heckman. I work at Loretto. Can you guys hear me?
Yes.
Yes.
Hi. So I just want to, yes, I work at Loretto, and it is a big facility. I can touch base on being a nurse's aide. It's really tough. The ratio is 15-1. You have 6, 7 Hoyers and then 4 or 5 feeders. It's really tough on a day-to-day to get that job done as an aide. I'm also a secretary, so I go out there and I help feed and I help toilet people, and it takes away from my job every single day that I'm doing just to help the residents, because it's really sad when you see someone and they have to go to the bathroom and there's no one around because they're off doing care on other people and they also need help. So That's what makes the turnover also high, because of the work that they do every day is very hard and no staff. So no one wants to stay in healthcare anymore. They'd rather go and work at a fast food place as opposed to a nursing home. So the future of our facility really depends on the increase of Medicaid. Thank you.
Thank you, Tina. All right, next I'd like to introduce Pat O'Connor, the Vice President of Long-Term Care Operations at Catholic Health.
Good morning. I have been with Catholic Health for 16 years and I've worked in long-term care administration for 35. I started my career as a nurse's aide at the Episcopal Church Home. Allow me to share a little bit about Catholic Health, and much of what I say may be familiar because we all have the same issues. Catholic Health provides care for Western New Yorkers and a wide array of services. We have 4 hospitals across 5 campuses. We operate more than 75 outpatient imaging, primary care, and neighborhood health services and specialty sites. Our 3 home care agencies, our caregivers traveled 1.4 million miles last year, visiting patients in their homes. In my particular area of expertise, we operate 4 highly rated and well-respected long-term care facilities with a total of 484 beds, providing short and long-term care. Those facilities are Father Baker Manor, Macaulay Residence, St. Catherine La Brea, and Mercy Nursing Facility at OLD. Across our system, we are the region's leader in providing safe, high-quality care while caring for a significant portion of patients who rely on Medicaid for their health insurance needs. We're proud of our record and our reputation for the services we provide and our mission to reveal the healing love of Jesus to those in need. We provide care, but it does come at a cost. In order to ensure that the staff and services are necessary to meet the needs of our patients and residents in our nursing homes is there, we have been operating at a loss for several years. We have had to rely on the support of Catholic Health to keep our operations going and provide a continuum of care across the system so that patients don't get backlogged in our hospitals. But this level of support is not endless. In supporting these unfunded services, Catholic Health ended last year with a loss of $175 million. This in part was due to the inadequate level of reimbursement that we receive for the care of residents and patients who rely on Medicaid. We've dug into savings and used funds that were designated for repairs, growth, program development, and other services to keep our healthcare system operating. Losses of this magnitude, as you can imagine, are unsustainable. They jeopardize the very future of our facilities. Something must be done to improve the reimbursement that we receive to care for the patients that we are taking care of. As it's been noted, the largest expense in any nursing home is staffing. Despite our best efforts at recruitment, including negotiating highly competitive wage and benefit scales with our union represented associates, we are unable to fill all of our vacant positions, and we have dozens and dozens remaining. We've had to rely on costly agency staffing to ensure adequate staffing levels and maintain the ratios that our residents deserve for care provision. We've spent over $10 million in 2022 in our nursing homes providing agency staffing. We want to fill our positions. We want to have our own staff and provide continuity of care and consistency of staffing. But we face greater competition than we ever have for entry-level employees. Other businesses who have raised their minimum wage can raise their prices. They can charge their customers more for the product. We can't do that. We're left to whatever the insurers or the regulators feel is an adequate level of reimbursement for the service we provide. So we raise our wages, and that's why we're running out of money, because we feel that the staff deserves increased wages and increased benefits. They deserve more than somebody who's frankly flipping hamburgers, taking care of human beings. And we want to be able to pay better wages, but we can't do it if we don't have the money coming in. We must rely, as I said, we rely on what the regulators says is adequate. We haven't had an increase in 15 years, as you've heard. And I ask you, could you have gone 15 years without a pay increase, particularly in these last few years of record inflation? And New York State is the only state in the union that doesn't have a system in place to adjust Medicaid based on inflation. As with all Americans, expenses are going up, our nursing home expenses. Catholic House cost per unit is up 60% year over year. Supplies are up 20%. Energy is up 17%. Drugs are up 44%. Because of this imbalance between revenue and expenses, our long-term care facilities collectively faced financial losses in 2022 of $26 million. To give you an example of the inadequacy of the rates, we are reimbursed at $206.91 per day for a Medicaid resident at one of our facilities. We spend $357.43 per day caring for that resident. We lose $150 each day for each Medicaid resident that we take care of. Financial pressures on nursing homes have led the industry to facility closures and reduced census, leaving seniors without the care they need. Bob referenced this firsthand experience in Kenmore Mercy. The staffing crisis makes matters worse. The reality is that this is unsustainable. And this situation is leading nursing homes to take beds offline, nursing homes to close, or to be sold to low-quality providers. This has an impact on the entire continuum of care, and we worry that upstate residents soon may have nowhere to go when they need quality care for their loved ones, especially then the needs are going to increase as the baby boomers hit Golden Pond. Catholic health hospitals are seeing fewer inpatients overall, and this bed crunch is causing us to see a backlog in our hospitals, and Bob referenced it as well. In years past, our hospitals might have anywhere from 8 to 10 patients waiting in the emergency department for a bed in the acute setting. We're looking at sometimes 40 to 50 patients at a time in an emergency room, waiting for admission to a bed upstairs that's waiting for a patient upstairs to go to a nursing home, but there's no place for them to go to. So this is causing an upstream backlog and healthcare crisis across the entire continuum. You know, and just as noted, New York's Medicaid rate is the lowest in the country when you compare to revenue expenses. In the 2023 budget, 2022-23 budget, New York finally added 1% increase to nursing homes Medicaid rate after 14 years with no increases, which does not make up for any of the underfunding. And New York State is the only state that cut funding to nursing facilities during the pandemic. Isn't that shameful? The hardest hit facilities during the pandemic, and we had to suffer cuts to reimbursement for the hard work that the staff was doing to keep our residents safe during the pandemic. North Carolina raised rates by 40% during COVID. New York State cut them by 1.5%. Pennsylvania increased rates for nursing homes by 17.5% in 2023. And South Dakota did a one-time 20.3% increase and a 6% inflationary increase. In closing, we are urging the state to include a 20% rate increase in nursing home rebasing as part of the upcoming state budget. We also urge the administration to ensure that the proposed budget does not include any new cuts to the nursing home industry. And I thank you for your time.
Thank you, Pat. I'd like to now turn it over to one more of our virtual panelists, Kimberly Stanley, who is a licensed practical nurse at Wesley Gardens out in our Rochester area.
Hello?
Hi, Kimberly, we can hear you.
Okay, I'm sorry about that. Good morning.
Good morning.
I've been in the field for 20 years. I started out as a home health aide, excuse me, and I went back for my certified nursing assistant. Ultimately, I became an LPN, which I've been for almost 19 years now. As healthcare has evolved, we've noticed more staffing challenges, especially in the wake of the pandemic. It's been a really, really rough transition over the years. And it's not uncommon that when we're working day to day, that one nurse has 32 residents that we're passing medications to, administering treatments, doing all kind of things for them, maybe transferring them, helping the CNAs with their care, because sometimes the staffing ratio is 1 CNA to 32 residents. Sometimes I've seen that as well. So maybe sometimes it's just me and 1 CNA on a unit and we're working all day. Only to work like this all day, not get any assistance, helping pass trays, helping to feed the residents, toilet them, take them to the bathroom, with everything else going on. In the midst, you might have a fall or a skin tear, a fracture, anything. You're dealing with all of these things in combination. So sometimes when it's time to get ready to go home, only just to be asked 5 minutes before it's time for you to leave, can you stay and do it all over again for another 8 hours? Excuse me. It's been my experience that nursing is a thankless job and it's a work of art. However, I feel like we should be paid the wages that we deserve so that we can get the proper funding to get the proper staffing, because it's a revolving door continuously. Sometimes people walk out in the middle of a shift only to turn right back around, and you'll see them a week or two later, maybe later on in the week, because they need staff. So it's very trying time right now. We really, really need the funding.
Thank you, Kimberly. And our
You're welcome.
last panelist is James Funderburk. He's a housekeeper at Elderwood at Williamsville.
Good morning, people. Listen to everybody here speak. You've done a great job, and it's really not too much for me to say. But one thing that I want to drive home is the on-ground experience to this. It's no secret. We need the state to step up. We need it. And one thing I want to talk about is chemistry in the workplace. As previously said, not a long time ago, maybe a few years back, you had aides, you had nurses that was at these facilities 10, 20, 30 years. That brings chemistry. That means if I'm coming here every day for the last 30 years, I know Miss Ruby's routine. I know when she don't move right. I know when she ain't breathing right. That can possibly save a life. And me being at the facility I've been at, I've witnessed that. You know, I had a situation a couple weeks ago. You know, I'm a housekeeper, but I'm one of those, I'm fun. I get people their newspaper, I get coffee. Oh, okay, I'm sorry. But yeah, so I had an experience a couple weeks back. As you know, we all in Buffalo, New York. We all know. I'm sorry, y'all hear me now? Okay. We all know, we all in Buffalo, New York. We all know we witnessed the, you know, Buffalo Bills take playoff loss. So it's one resident in particular that is real adamant about the Bills. And, you know, so I walk in, I'm kind of walking on eggshells, asking him about the game. So I walk in and I asked him, did he see the game? He said no, because his remote was on the ground and no aide answered this call like for about 5 hours. And just the simple things like that, that we do not think about. And increasing Medicaid reimbursement rates will help with that. It's things we don't think about like that. Like, you know, is my family member getting the opportunity to brush his or her teeth? Do they have the opportunity to wash their face? Or is it not enough washcloths because the laundry staff is short? You know, and it affects the workplace because, you know, as Mr. Scott West had said, you know, me and him had the honor of working together, and he did a really great job at my building. But it's only so much you can do in the building. We need the state to step up, because no matter how, you know, no matter how good you are as a worker, it gets to you. It gets to you. You know, to work in nursing homes, you have to have integrity. You got to have compassion. And when you see little things like that, when you see, you know, I'm a housekeeper and I notice a resident not breathing right. How is it you in here cleaning and taking their vitals and you don't see this? It don't sit well with me. And one more thing I would like to tell y'all that's very important. I used to be an aide, maybe about a year. And one thing that I was taught when I was trained was, if you have to take care of more than 7 residents, you will not be able to properly take care of them all. Somebody's gonna get cut short. And, you know, not to speak too much on the price the residents pay, it's a pretty penny. And if any of our loved ones is in this nursing home, we want to be assured, my parent, my grandmother, grandfather, whoever is being taken care of the right way and being treated with dignity and respect. And when we work in short, you're going to become snippy. Everything's going to bother you. And these residents do not need to be in this environment, because we get to go home after 8 hours. They got to deal with that 24/7. So again, we need the state to step up. What we are asking for is fair, and most importantly, is necessary for not only us employees, but most importantly, these residents who we do this for. Thank you, Raymond.
Wow. Thank you to all of our panelists for all of your words today. We're going to have Todd Hobler come up really quickly, and we'll be wrapping up our program shortly after.
You got it? All right. Thanks, Grace. Thank you, all of you, for your presentations. I mean, everybody spoke with amazing passion. It really, and from Albany to Syracuse to Rochester, I mean, this story really the same, that our employers are under-resourced. It has a significant impact on people who provide care and the people who are being cared for and our community. It's just as on the union side. I was talking to one of our members who'd been working in dietary at one of our nursing homes for 7 years. And she said, I'm making minimum wage. I don't know if I can stay here. Right? And I remember when I started this job, Bob and I were talking, we started around the same time in 1995. Our members were making minimum wage, right? And so we find ourselves here again, that, the people who are doing this essential, important work and providing, trying to do the best they can under really difficult circumstances, aren't able to stay at their jobs and do the work that they love because of the circumstances. The circumstances are that the reimbursement rates in this state and particularly upstate are too low to cover. Oh, all of a sudden it got loud. Was I not? Yeah, that's good. Okay, I don't want to be loud. So just sort of in the recap that when we look at the disparity of Medicaid rates in New York State, I mean that is significant. That our workers are paid less than counterparts doing the same job elsewhere in the state. We have the highest turnover rates up here, capital region, upstate, than anywhere in New York. And that our healthcare providers, as you've heard, are under-resourced, significantly under-resourced. And as a result, there is a crisis in upstate healthcare. It's real. I mean, we're not just sounding the alarm because it's the same old thing. It's not the same old thing, and we're at a crisis stage. That's why we brought everybody here to hear the testimony. to really bring attention to this problem. It's chronic. So, you know, on the hospital side, the employers and the union are asking for a 10% increase in Medicaid rates. On the nursing home side, we're asking for a 20% increase in Medicaid rates. And here we're talking about, and we're sort of modeling this because, you know, one of the things, the rates are higher downstate, right? So how do you construct, you know, a Medicaid rate increase that is fair, right? And so one of the things we're thinking about is if the increase is put on the median rate, which, as you've seen, 90% of our nursing homes are below here. That would help the upstate providers more to get closer to sort of Medicaid rate parity than we have currently, right? So it's something that we would like our lawmakers to look at when you get into budget negotiations with the governor. And as you heard, the Medicaid proposal from the governor was woefully inadequate, and we can do better. We have to do better, really. I mean, otherwise, you know, we ought to ask ourselves, you know, what kind of, you know, society we want to be, right? A place where, you know, the most vulnerable are not provided the care that they deserve. So that's our ask, that you all, the legislators and the folks that we elected to represent our communities and provide for us at the state level, take up this problem, address this problem, and help us fund these facilities in a way that promotes human dignity, really, and allows us to get to where we need to be in providing the care that everybody deserves when they need care. So we're gonna ask the legislators here to, you know, if they have any questions or stand and make a commitment to this cause, because we really, that's why we called you all here together, so that we can really have a united employers, labor, workers, legislators fighting for the same thing in Albany. Okay.
Oh, thank you. Todd, I just have a question about the Medicaid rate. When you say there's the median rate, I guess I'm just not clear on how that gets distributed across the state.
It's complicated.
Yeah, I know.
Yeah.
And I kind of glaze over when I, you know, start to think about it. But so there's obviously is there like a downstate rate and are there several rates, or how it goes by facility?
You know, we have 4 facilities, each
right.
per Medicaid resident, each day is different at each of our facilities.
So what we talk about in the median, so what we showed in the slide is that the Medicaid, the regional rates, right? I mean, they are regional and they vary by facility. There's a long, probably very complicated explanation for each facility, why they're at whatever rate that they're at. But our average rate in upstate is well below the rest of the state. And the median being 241, right? For New York State Medicaid for nursing homes, we're at 214, right? So if you, that looks like, well, it's only $30 a day. $30 a day times 100 beds times 365 is a lot of money. And that's what we're dealing with here.
And that's not, it doesn't cost us 214 or like Catholic Health, like $190. It doesn't cost us.
That was a great number. $350.
A day
Yeah.
is what we're spending on staff.
So if you're providing care, $150 loss a day. Yes. And that's unsustainable.
Okay, so the downstate rate is higher, possibly based on increased costs down in the New York metropolitan region, and obviously cost of living might be a little higher down there for people.
We're not trying to
right.
make this an upstate downstate thing, and there are cost differentials. What we're really trying to highlight is that the Medicaid rates in upstate are way behind the average rates in New York State. Yet the jobs are the same, the needs the same, the residents and the patients, need the same care as they're getting elsewhere. And so that proposal that we put the increase on the median helps upstate.
Yeah, I mean, that's
Yeah.
what's interesting, the percentage of nursing homes below.
Right. Right, so they do much better downstate, obviously. Well, okay, thanks. Thanks for explaining that to me. I think I understand it a little better. I thank everybody who spoke today. It was really good to hear. Again, I know you probably feel like a broken record because we do this again and again. And to the extent that I'm a part of the government, I apologize for that. But you know, you have my support. That 1% last year, I whispered to Haley, I said that was just insulting, I thought. And it just doesn't take care of the problem. So to the extent that my one little voice out of 150.
We accept your apology for
Yeah.
the state. There's a way to make up for it.
Well, you have my support. Thank you, Todd.
So thank you. Assemblymember Conrad wished he could be here. His heart and his soul is behind this effort. He realizes that this is a huge undertaking. I'm Peter Stumiller. I'm his special assistant. So I'm glad to be here as well. I do want to echo what Assemblymember McMahon has said, and Monica Wallace was here, and Assemblymember Rivera's campaign or office is here. But I do want to remind folks that our delegation in Western New York took a lead back in February, almost 30 days ago. And the delegation wrote a letter to the governor, and I'm just going to share an excerpt. So this would be Assemblymember Burke, Conrad, Wallace, McMahon, all signed on to this effort to convince the governor before she even released the budget that we need to have a 20% increase in the Medicaid rate increase for nursing home rebasing as part of our upcoming or her upcoming executive budget. The letter goes on to explain the dire straits that our nursing homes have across the state. So we urged the governor before she even released the budget. So the assembly members across this region understand unequivocally that this is woefully inadequate. And we have confidence that the one House budget coming out of the assembly will certainly address this. And we hope that as negotiations progress, sanity is restored to this issue. And I'd like to thank all of you from SEIU and our healthcare providers for echoing in unison and collaboration that voice that needs to be amplified. So on behalf of Assemblymember Conrad, thank you for all you're doing.
Are there other questions or comments?
While we're waiting, I just want to add on to what Todd talked about when we were talking about the median. If you think of it like this, say we get our 20% that we've been fighting for. I'm a nursing home. I don't care where I am. I'm a nursing home in this city in New York State. And as a nursing home operator, I receive 330 days per resident per day. If I were to get 20% on top of that, I would be doing even better for my residents, right? But what about the 20% on $150 per resident per day facility? Because that 20% means less dollars comparatively than the facility that has more. And so there really hasn't been a look at all of these facilities in all of these years. And that's why Todd was talking about this model of addressing the median. If we raise the median, we're creating almost a floor, right? No facility would be below this because they'd have to get closer to the median. And potentially no facility would really get too high, and they might not need all of that reimbursement in a simple way of putting it, right? They might be doing fine. So that's why not only is the 20% so important, but the second piece of this, which is really the critical part that the upstate legislators can play a role in, is talking about how we address the disparity. And one of those models is what Todd mentioned, and we will be following up with you all, you know, as negotiations progress so that we can continue those discussions.
Thanks. So again, thank you all for coming. And I do want to say that we would ask the legislators who are here that you talk to your leadership about this. It's really that important. Many of you might know 1199 is heading to Albany on March 21st. We have, I think, close to 15,000 people signed up at this point. There'll be a lot of buses, parking will be sparse, so, and a lot of purple, and we're gonna be there coming to support this effort, what we're talking about, and we're hoping some employers come with us on the bus and join what is just a really critically important fight. And we're all united in the work that needs to get done. I don't want to close without thanking everybody who took part in putting this together. What? Oh, geez, I'm sorry, I didn't see it.
I'm gonna come up. I have some letter, comments from Senator George Morello. Okay, great. Kind of hard to sit down. Yeah, the senator wishes he could be here. He's got a big district to cover, and he had a prior commitment. So he wants to thank everybody from the 1199 SEIU, United Healthcare Workers East, and the Greater New York Hospital Association for partnering to present this critical, important forum. Few people would dispute New York's healthcare system is facing historic crisis. The pandemic has exacerbated labor shortages that have existed in our healthcare sector for at least a decade. Emergency rooms are experiencing historically long wait times. Nursing homes are on the financial brink with facility closures, loss of beds, hospital discharge backups, all too common. At the heart of these problems is a profound lack of funding. Medicaid rates have not increased in 15 years and are among the worst in the country. This financial neglect has depressed wages, worsened staffing, and undermined the quality of care. None of these outcomes are acceptable. While the healthcare crisis is a statewide problem, hospitals and nursing homes are further hurt by a wide disparity in rates. Downstate facilities typically receive significantly higher rates despite facing costs that are often comparable with those upstate providers. The disparity must be addressed. With the state facing $8.7 billion surplus, New York State has the opportunity this year to make up for the chronic underfunding by raising Medicaid rates 20% for nursing homes and 10% for hospitals. Doing so will be a first step towards stabilizing the healthcare system by providing funds needed to attract more workers, retain dedicated personnel already staffing hospitals and nursing homes. New York State healthcare system has been brought to its knees for more than a decade of government disinvestment and extreme stresses, particularly over the last 3 years. If we want to ensure quality, accessible healthcare and skilled nursing care are available for New Yorkers, we must act now. Thank you for everybody here today. Thank you for your insights. Thanks for the panel. And again, the senator hears you, he gets what you're saying, and he's going to work with you to do whatever he can. So thank you.
Yeah, April has asked me to announce that we're taking questions from the press. So, you have any? No? Okay, that's all right. Just. All right, while we're waiting to see if there's any, there's press across the state, there are legislators across the state, there's and we're waiting to see if there's any questions out there. Jim, I just want to say a couple.
Yeah, my name is Jim Serrato. I'm the area vice president for 11. I'm the area vice president for the West New York Hospital Division for 1199. And I started my career in the nursing home industry. You said earlier you worked at Episcopal 35 years ago. I worked at Episcopal, I think 41 years ago. Beautiful nursing home, was probably one of the finest in Western New York. We had residents who came from other nursing homes to Episcopal because it was such a great nursing home. I ended up moving over to St. Andrews. Presbyterians had great facilities. You said earlier about some of the care that's happening now in our facilities. When I was in the nursing home industry, we took care of our residents, and when they got a cold, they needed an IV, they went to the hospital. We didn't do any of the stuff that's happening in these
nursing homes today. One of the nursing homes I represent has a pediatric unit in it, you know, so we have babies that are in the nursing home. And you hear some of the stories that come out of, you know, what the work that's happening there and the short staffing, you know, it'll make you cry when you hear the nurses saying, you know, we got babies that are standing there going, pick me up, and you can't because the staffing's not there. And if you have 3 or 4 or 8 in a facility, that's what happens. So what I want to say is the number of the 20% that's being asked for is ridiculous, right? That's the reaction you're going to get. Who gets 20%, right? Who gets 20%? But I think this panel did a great job of saying we had zeros for years. We had ones for years. Just even if you think about it, increasing the rate 1% a year over the period of time, right? We wouldn't be in the problem that we're having now. So that's the fight. And I'm hoping that when we go back, they're saying, well, they're asking for 20, but they'll be happy with 3. They'll be impossible. This will not work. This will not work. And it's great to see everybody coming together. I've been working here along with Todd for 25 years now. And this is great to see, you know, all entities coming together, our employer partners, different labor partners that we have. I think it's very important that we all work together. Where you need help from us, let us know. But the ask is not, oh, 20% is ridiculous and it's not going to happen. It has to be a number like that, if not more, you know, because we think the structural changes that need to happen. I think, again, everybody's doing a great job, but we got to work on this together and push this together. And I just want to thank everybody for coming again.
Larry? You have a statement to read?
Yep, I did want to read, Senator Brooke wasn't able to stay for the whole call, chair of the Mental Health Committee. But she did have a statement. Thank you to 1199, and this is in the chat, and to all the members who are speaking out on this issue and sharing their stories. New York State has to do the right thing this year by increasing these Medicaid rates. Please continue to speak up about how we are failing both patients and our workforce here in upstate New York. Happy to support these efforts.
Excellent. Thanks, Larry. All right. You said? Yeah. All right. All right. Well, again, thank you for coming out. Really appreciate it. I'm getting cued from the back of the room. I'm just about to say the thank yous. So I'm going to say thank you to Peter DeJesus, who's our political coordinator back there, who made sure I asked Local 10, John and his partner in the back. They did like, this is hard stuff to put this all together and be across the whole 90, call it the 90 corridor, right? And they did a great job. So thank you very much. I appreciate it. Grace, you know, one of our younger VPs, she did a lot of the PowerPoint and put the panel together. And I'll tell you, it helped get a lot of our employers on. I should have brought the letter that we sent to the governor saying we're all united in this. And so great work. Mark is our political director for upstate in the back, and his team across the state helped put this together. Maurice Brown in Albany, and Greg Speller, and April right here, and Allison, our communications team. This has been, you know, it's been a long time since we've been able to do something like this live and in our office. And I again, this was really an important discussion. Thank you so much for your passion. We will follow up. Okay. All right. Thank you very much.
Thank you.
You didn't mean to spoke.
I didn't say anything that was on there.
You spoke right from the heart. I thought you did fantastic.
Thank you. Thank you. It was very nice meeting you.
Nice to meet you.
Hopefully. I really don't understand how any of it works, and I meant that.
How are you? Yeah. How you been?
I enjoyed
April, we have one hand up.
Who is she?
Esmeralda is Andrea. Andrea, I think.
I agree. So.
Who's she? It's Lorraine.
Hi, Lorraine, she's a member from Guilderland.
Your name always comes up. You and,
Can you hear us?
what's the one name?
Yes.
He was there for a while. Worked evening shift. Bobby?
Yeah, there's a lot of people talking.
Congratulations on his retirement. And I said,